The special event is we have done the world's smallest knee, the smallest possible knee in the world, that we have replaced it. So this is patient specific knee because this patient has that small femur, so that's why it is required. We have specially designed this implant and then placed in this patient. So this is world's smallest knee replacement that I can say.
So what all problems you
The important problem I face is I didn't had an implant only. So I had to sit and design the implant. So Orthotech company helped me in doing that, and that's why we are able to comfortably do the surgery part.
how long was this treatment?
It took for roughly around 6 months, and the surgery was half an hour.
Risk factors involved, that also you can.
Risk factor involved, since the planning was very long and very precise, probably on-table risk factor were very minimal, and post-surgery, yes, patient recovery was good. The most difficult is what we faced was on the planning part and on the designing of the implant.
And the patient's back to the normal life.
Yes, he is much more comfortable than what he was.
Okay, sir.
Sir, you
My name is Punit. I am a consultant orthopedic surgeon with a special interest in robotic-assisted joint replacements.
can brief about today's.
So today's event is unique because we at Narayan have achieved a feat of doing relatively world's smallest knee replacement, which was customized for this gentleman, and we were able to change his life for better.
Okay, sir.
ಫಸ್ಟ್ ಏನು ಅರ್ಜೆಂಟ್ ಇಲ್ಲ.
ನಮ್ಮ ಹೆಸರು ರವೀಂದ್ರ, ನಮ್ಮ ಊರು ಗುಲ್ಬರ್ಗ ಸಿಂದಗಿ. ನಾನು ಚೆನ್ನಾಗಿ ಆಪ್ರೇಷನ್ ಪ್ರಶಾಂತ್ ಡಾಕ್ಟರ್ ಆಪ್ರೇಷನ್ ಸರಿ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾರೆ. ನಮಗೇನು ತೊಂದರೆ ಇಲ್ಲ, ಸರಿಯಾಗಿ ನಡೀತದೆ. ದೇವಸ್ಥಾನ ಎಲ್ಲ ಭಕ್ತ ಕರಿತಿದ್ದಾರೆ, ಎಲ್ಲ ಓಡಾಡ್ತಿದ್ದೇವೆ, ಏನೂ ತೊಂದರೆ ಇಲ್ಲ.
ಎಷ್ಟು ವರ್ಷದಿಂದ ಇತ್ತು ನಿಮ್ಗೆ ಸಮಸ್ಯೆ?
ನಮಗೂ 8 ವರ್ಷದಿಂದ ಭಾಳ ತೊಂದರೆ ಐತೆ ರೀ. ಈಗ ಆಪ್ರೇಷನ್ ಮಾಡಿ 7 ತಿಂಗಳು ಐತೆ ರೀ, ಸರಿಯಾಗಿ ಆಪ್ರೇಷನ್ ಆಗಿದೆ ರೀ.
ಎಷ್ಟು ವರ್ಷ ನಿಮ್ಗೆ ಈಗ?
ಈಗ ನಮ್ಗೆ 53 ವರ್ಷ.
53 ವರ್ಷ
ರೀ. ಈಗೇನು ತೊಂದರೆ ಇಲ್ಲ.
ಏನು ಕೆಲಸ ಮಾಡೋದು ನೀವು?
ಈ ದೇವಸ್ಥಾನ ಪೂಜೆ ಎಲ್ಲರೇ ಕಾರ್ಬಾರ ಮಾಡೋದು ಗೊತ್ತಿದೆ ಸರ್.
8 ವರ್ಷದಿಂದ ನಿಮ್ಗೆ ಸಮಸ್ಯೆ?
8 ವರ್ಷದಿಂದ ಪೇನ್ ಇತ್ತು ರೀ. ಈಗ
ಮದುವೆ ಮಕ್ಕಳೆಲ್ಲ ಇದ್ದಾರೆ?
ಮತ್ತೆ ಕಡಿಮೆ ಇದೆ ರೀ.
ಮದುವೆ ಮಕ್ಕಳೆಲ್ಲ ಇದ್ದಾರಾ?
ಹ್ಞೂ, ಒಂದು ಹುಡುಗ ಒಂದು ಹುಡುಗಿ
ಇದ್ದಾರೆ.
ಈಗ ಪೇನ್ ಏನಿಲ್ಲ.
ಏನು ಪೇನ್ ಇಲ್ಲ.
ಈಗ ಪೂಜೆ ಮಾಡ್ತಾ ಇದ್ದೀರಾ ಇವಾಗ?
ಪೂಜೆ ಮಾಡ್ತೀವಿ ಸರ್.
ನಾರ್ಮಲ್ ಪೂಜೆ. ಈಗ ಎಷ್ಟೊತ್ತು ನಡಿಬೋದು ನೀವೀಗ ನಡೆದ್ರೆ?
ನಡೀತೀವಿ ಸರ್, ಅದೇನು ತೊಂದರೆ ಇಲ್ಲ.
ನಾರ್ಮಲ್ ಆಗಿ ನಡೀತೀವಿ?
ನಾರ್ಮಲ್ ಆಗಿ ನಡೀತೀವಿ ಸರ್.
ಮೊದಲು ನಡಿಲಿಕ್ಕೆ ಆಗ್ತಾ ಇಲ್ಲ?
ಭಾಳ ನಡೆದ ಭಾಳ ತ್ರಾಸ ಆಗ್ತೈತೆ.
ಈಗ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಏನು ತಗೊಳ್ತಾ ಇಲ್ಲ?
ಟ್ಯಾಬ್ಲೆಟ್ ಏನು ತಗೊಳ್ರಿ ಸರ್, ಯಾವಾಗ್ರೆ ಒಂದು ತೋತೆ ಇಲ್ಲ ಅಂದ್ರೆ.
ಪೇನ್
ಮತ್ತೆ ಬೇರೆ ಏನೋ ಸಮಸ್ಯೆ ಇತ್ತ ನಿಮ್ಗೆ?
ಏನು ಬೇರೆ ಏನು ಸಮಸ್ಯೆ ಇಲ್ಲ.
ಇದೊಂದೇ ಸಮಸ್ಯೆ ಇತ್ತು?
ಇದು ಒಂದೇ ಮೊಳಕಲ್ದು ಒಂದೇ ತ್ರಾಸ
ಸಮಸ್ಯೆ ಇತ್ತು.
ಈಗ ಸರ್ಜರಿ ಮಾಡಾದ್ಮೇಲೆ ಏನು ಚೇಂಜಸ್ ಬಂದಿದೆ ಇಲ್ಲ?
ಏನು ಚೇಂಜಸ್ ಇಲ್ರಿ, ಏನು ಸರಿಯಾಗಿದೆ.
ಸರಿಯಾಗಿ
ಅಷ್ಟೇನು ಇದಿಲ್ಲ ರೀ, ಸರಿಯಾಗಿದೆ.
ಬಾಡಿಯಲ್ಲಿ
ಏನು
ಇಂಬ್ಯಾಲೆನ್ಸ್
ಇಲ್ಲ, ಬಾಡಿ ಪೇನ್ ಇಲ್ಲ, ಇಲ್ಲ ಸರಿಯಾಗಿದೆ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು.
Patient-specific implants are there for different cases. Like you have a deformed femur, you have a different set of shoulder, so you have specific implant for that. Like that, every organ, every part has a specific implant. Many of the time, this is implant for the hip, where hip is too much deformed. They design the implant for that, they give it. But those are of standard sizes. In this case, the femur is very small. So for this femur, this further implant, yes, this is the first one.
Hello.
Depends on, like you do 100 cases, 80 patients are successful. Yes, it is successful. 80% successful. In this patient, I have done one surgery and it is successful. For me, it is 100% successful. So how do you say success? It depends on how many numbers you do. So it is long term, you have to study and see.
Is there any age?
Patient's requirement. Age limit is not there.
Normally we do a joint replacement for an individual who is above 50 years. That's a starting point. We have got done in 45 also, but the basic cutoff what I would take for the joint replacement.
Long-term exposure I need to do. The retractor, I pull. Even my hand was also not a challenge because in normal robotic care, I can comfortably take the broken pieces from the joint very easily out. Here, my fingers were not going comfortably because in very narrow space. So every step was a challenge because it is very, very minute. Results. So we are working according to that. Our hospital is cooperating in that case. That's why we can give good amount of patient benefits.
This surgery is feasible and can be done. It is not very expensive. It can be done with a very economical price. But the importance is it can be done now, which otherwise could not have been done. The price is a different issue here. The issue here whether we can do a knee replacement of a person who is as tall as a child of 5 to 6 years, right? So that's where the question is, and we have successfully done it. The price comes the next point, and it is affordable. It can be done.
Which can be addressed for his lifetime. Yes, we are going to address it earlier. For example, if a patient has 40 years, but his bone is very badly damaged and he is not able to carry out his daily activity, there is no point in saying that you wait for 10 years, after that I do surgery. If the patient has a problem which I can solve his problem, I would solve it at present, and I would try to make sure that it works for longer duration. Yes, after 30 years, if it has the implant gives a trouble again, I can redo the surgery and correct it. I just don't want the patient just to suffer just because he has not crossed the